The number of cancer fatalities is increasing every day. Worldwide, approximately 10.8 million people per year are diagnosed with cancer, and around 6.7 million die of it. So this is truly one of the greatest challenges of our time. Surgery, chemotherapy, and radiotherapy are the three most important types of cancer treatment. But chemotherapy and radiotherapy deplete the immune system of weakened patients, adversely affecting healthy cells. However, there is an alternative cancer treatment. It is an effective anti-cancer agent Ukraine, created on the basis of quelandin alkaloids by Dr. Vasil Novitsky, an Austrian citizen of Ukrainian origin. He called his invention Ukraine in honor of his motherland Ukraine, where he made the first steps in the development of the drug. Ukraine has been tested by more than 280 renowned scientists from 24 countries in 60 universities and research centers, and their studies have confirmed the efficacy, safety, and quality of Ukraine. It is the first and so far the only anti-cancer drug that is toxicologically effective against cancer cells but doesn't damage normal cells. It has always been the greatest wish of scientists and cancer researchers to find a preparation which kills only cancer cells and leaves healthy ones undamaged. In other words, a preparation with a selective effect only against cancer cells but not against healthy cells. The development of Ukraine has shown that the problem can be solved and has changed our ideas about healthy and cancer cells. The first application for the registration of the drug was filed in 1976. Under the law at the time, the medical preparation should have been approved and registered by the Austrian Ministry of Health immediately, because it is produced on the basis of products that have already been registered and clinically used. However, the Austrian authorities have still not registered the product. Meanwhile, many doctors have started using it successfully in other countries. The number of cases confirming the evidence of the efficacy of this preparation has greatly increased. This medical product has helped to cure many patients not only in the early stages of cancer, but when doctors have declared them to be incurable and send them home to die. In Ukraine, this drug was first registered in 1998. Since then, it has been able to help many cancer patients. However, in November 2011, by order of the former Ukrainian Minister of Health, Mr. Onishchenko, registration of Ukraine was suspended for no reason whatsoever and in contravention of the law. However, worse happened on the 4th of September 2012, when around 60 police officers stormed the home of Dr. Novitsky in Vienna and confiscated more than 200,000 Ukraine ampoules. The inventor was arrested and imprisoned for 6 weeks. Because this medicine with negligible side effects hasn't been registered, cancer patients have been denied the chance of improving their quality of life, or at least easing their suffering, prolonging their lives, and in many cases even saving their lives without the usual almost inhuman side effects of chemotherapy. During the First World War, 9 million soldiers and civilians were killed, and the total casualties during the Second World War were over 50 million people. The number of cancer deaths since the invention of Ukraine in 1976 until now is commensurate with the casualties of both wars. So is it not a crime against humanity to forbid the use of Ukraine? On the 25th of January 2013, there was a press conference in Vienna devoted to the preparation Ukraine and the recent events surrounding the drug and its inventor, Dr. Vasil Novitsky.
Gleichfalls bedeutsam ist auch der Anlass unseres heutigen Zusammentreffens, nämlich
Good afternoon, ladies and gentlemen. Thanks to all of you present today at our press conference. The theme of our meeting is a modern medicine, and I am honored to speak as a moderator today.
Mit dem Schwerpunktthema verbotene Krebsheilung.
So, modern treatment methods and a prohibited cancer treatment. With a question mark. Why prohibited? And why with the question mark? The point is that today, as before, in this branch of modern medicine, doctors and scientists are trying to find a drug that doesn't cause harmful side effects while treating cancer.
Prinzipiell schonenderen Methoden positive Heileffekte zu erzielen. Das steht im Vordergrund.
Of course, their most important goal is to get positive results from the treatment. Certainly, such attempts have not just started today. Scientists everywhere have always been trying to find such preparations. For example, in this context, I could cite treatment with phytotherapeutic agents. There have always been many attempts to improve knowledge in the medical field. In cancer treatment, scientists and doctors have made great efforts and worked intensively on finding new curative methods.
Sich neue Wege zu erschließen. Und manche dieser neuen Wege wurden geradezu
It should be emphasized, not without success. But often these new drugs and methods are classified as unallowable. It is impossible not to mention the fact that there are always two sides in such cases. One side says that it is a kind of a tactic to prohibit such drugs, and the other that the effect of these drugs has not yet been studied.
Diese Erörterung hier, dass einer der bekanntesten Forscher
It means the opinions are quite controversial, and these completely opposite opinions have led to the fact that one of the most famous scientists in the field of modern cancer research and treatment, Dr. Wasyl Nowicki, was arrested.
Das war sehr verwunderlich, weil, soweit mir bekannt war, hat sich dieser Forscher seit Jahrzehnten redlich bemüht, Mittel.
I opened the newspaper and read, Dr. Cancer is in jail. I must say I was very surprised, because as far as I know, Dr. Nowicki has been trying to spread information about his medication to people for years. I must admit that I have heard only very good and positive reports from people about this drug.
Davon losgelöst ist der allgemeine Aspekt auch von Bedeutung, nämlich bleiben wir bei der Krebsheilung. Die Chemotherapie zum Beispiel, die klassische.
This is a very important aspect, and to discuss it we have some people present today who have used this medicine as experts. So we will discuss and shed some light on the subject of cancer, as well as traditional means of treatment, such as chemotherapy.
Da muss man sich schon bewusst sein, dass glaube ich, und wir werden es heute vertiefen und klären, dass die klassische Krebsheilung mit Chemotherapie eine Reihe von sehr großen Gefahren.
We will also discuss the question of whether they only have a positive side, because, as you know, they have a tendency to destroy not only cancer cells but also healthy cells.
Von sehr großer Bedeutung sind und dass man prinzipiell und tendenziell solche Sachen unterstützen soll, weil sie neue Wege ermöglichen und wenn man damit auch nur einem Patienten
Today we will talk about the serious side effects of classical, traditional chemotherapy, which are well known to all of us and which often carry great risk. And we also know quite a lot about such treatment. Therefore, I think that the study of new drugs should be carried out and fully supported. And even if it means that the life of only one patient can be improved or saved, the efforts will not have been useless.
Des Themas ermöglichen können. Wir werden also somit eine Podiumsrunde hier machen und nachdem wir das gemacht haben, stehen wir selbstverständlich auch für ergänzende Publikumsfragen offen. Also ich möchte einmal mit dem Herrn zu meiner Rechten beginnen. Er ist langjähriger Sektionsleiter des Wissenschaftsministeriums.
Now I would like to give the floor our guests, who are professionals from various fields of medicine, and who will help to shed light on our current topic and talk about their experience with this drug.
Alternatives Mittel herauskommt. Ich glaube, es ist ein ganz guter Zugang und dann werden wir erst das Medizinische vertiefen, weil wir beginnen jetzt sozusagen mit dem offiziellen Establishment, um zu zeigen, dass ja auch dort gang und gäbe ist, dass neue Sachen kommen, aber es ist vielleicht nicht so gang und gäbe, wie dann mit denen umgegangen wird. Und er hat das aus einer Perspektive wahrgenommen, die keinem von uns vergönnt war, weil er hat das direkt aus der Perspektive der Behörde.
I give the floor to someone who was director of the research department at the Austrian Ministry of Science for many years and is an official representative. He will tell us about the registration process of this new alternative medicine. After that, we will talk in more detail about medical topics.
Danke, dass Sie hier sind.
Dankeschön, meine Damen und Herren. Wie Sie gehört haben, war ich lange Zeit im Wissenschaftsministerium tätig.
For many years, I was a head of research department at the Austrian Ministry of Science and was responsible for providing financial assistance and supporting various research projects, not only medical, but also from other science fields. And I would like to start with a statement. During my work, I have seen probably 300 or 400 inventors from different fields of science. And believe me, that with help of recommendations of internationally renowned experts and relying on my fellow professionals, in a very short time I could separate chaff from grain. I must add that I agreed to support Dr. Nowitzki then, because I knew his invention was supported by many renowned scientists around the world, and by my former boss, Mr. Busek. It should be noted, Nowitzki showed himself to a good advantage. I would like to say that our ministry is not responsible for the drugs registration. The Ministry of Health answers for it. We only provide support for research of Austrian scientists, inventors, and help them in collaborating with universities. I would like to stress that the authorities of the Austrian Ministry of Health are obviously often unable to enter a constructive dialogue with Austrian professors. So, the question is, where and how the responsible institution chooses experts responsible for granting or rejecting registration. Wasn't it evident to them that, for example, in the USA and in Australia, Ukraine has already been used for more than 10 years in the treatment of rare cancers, and it should be stressed that their governments gave an official permit for this. I want to summarize my statement referring to Karl Popper, who wrote the book Open Society. In the dialogue between science and administration, Austria is not an open society, but a kind of closed job society.